Good afternoon, everyone. At this time, we're going to call the Health and Human Services Subcommittee to order. Today, we only have one agency report out, which is DHS Family Investment. At this moment, we have the phenomenal Tanya D. Zimmerman as our analyst. And Ms. Zimmerman, it's all on you.
Thank you. Today I'm presenting the analysis of the Family Investment Administration of the Department of Human Services, and this administration administers cash benefits and other grant programs to assist individuals and families in financial need. As you can see in the cover page here, the budget for FIA decreases by $348.4 million or 11.1% to $2.8 billion. And this is driven by the pandemic EBT benefits, which are not specifically budgeted in fiscal 2024, though as is discussed, as is noted later in the analysis, there is likely to be costs for that program in fiscal 2024. If you turn to page 6, that begins the discussion of the performance measures. The first of these is related to application processing times. During most of the pandemic, the applications have been relatively low because the department had extended certifications, recertifications for the public benefit programs. The ability to do that ended in December 2021. And so in January 2022, they restarted recertifications. And the application processing times began to increase along with the numbers of applications. So if you look at the bottom of page 7, this is some information on the average number of days to process applications prior to the restart of recertification and after the restart. And it increased among all 3 programs between 14 and 16 days for SNAP, a little larger increase for TCA, temporary cash assistance, an increase of about 4 days, and similarly, a little more than 4 days for the temporary disability assistance program, or TDAP. So the average number of days to process applications for TCA and TDAP are relatively similar. However, as you can see on Exhibit 2 on page 9, the percent of applications processed within 30 days is quite different between the 2 programs. TDAP has additional kind of documentation requirements that likely impact this. And as you can see, the percent of applications processed within 30 days is lower for TDAP, but both of them declined after the restart of recertifications. This is also evident in the percent of applications processed in longer than 46 days. And so in 7 of the months for which data is available, 30% or more of the TDAP applications were processed in 46 days or longer. And in 2 of those months, it was more than 40%. And we've asked the department to comment on the decline in application processing timeliness since the restart and the steps they're taking to improve the performance. The next discussion is on denial rates among the 3 benefit programs. As you can see on Exhibit 4 on page 11, the application denial rates are significantly higher for TCA and TDAP applications compared to SNAP applications, with denial rates of more than 50% in all months for TCA and TDAP, but under 30% in almost all months for SNAP. During most of the pandemic through December 2021, the department was waiving interview requirements for all 3 programs, but they began to require interviews again for all cases except for expedited SNAP cases, which remain waived through March of this year. With the end of that waiver, the applications that are denied due to missed interviews has become a top reason for the application denial. And this is a much higher reason for denial for the SNAP applications compared to TCA and TDAP. TCA and TDAP have verification and non-cooperation reasons as the top reason for denial in several months. And we've asked the department to discuss efforts they have undertaken or plan to undertake to reduce the number of applications denied due to missed interviews or missed verification and documentation. The next discussion is related to the distribution of the TCA cases among the work eligible and work exempt. The work exempt category is also sometimes referred to as the core caseload. And this includes cases that have received exemptions, for example, for having children under the age of 1 and things like that. So Exhibit 6 on page 14 presents information on the share of the caseload that's work eligible versus work exempt over time. The work exempt categories are the other and the child only. So as you can see in this, generally over time, as the economy improves, the share of the caseload that is work eligible declines. There was one exception to this in 2016 due to a change in policy about the categorization of people with long-term disabilities. However, in July 2020, at the onset of the pandemic, when the caseload rose significantly, the share of cases that were determined to be work eligible was about 59%. This was 1 month after the kind of peak caseload during COVID. This is much higher than it typically occurs. One thing that has happened as the economy improved, unlike other periods of economic improvement, the share of cases that are work eligible actually increased as the economy improved. And so that in July 2020, about 74% of the caseload was determined to be work eligible. This occurred in kind of 2 categories: state-only cases, which are immigrant and 2-parent families, and those were much higher during the pandemic than typically occurs, and have returned to more typical levels. So the decrease was significant there. There was also a significant decrease in the share of cases that were child only. The department had indicated this was due to returns to pre-pandemic levels, but DLS notes that the level of child-only cases in July 2022 was less than half of the pre-pandemic levels. We've asked the department to comment on the cause of that substantial decrease. Page 15 includes a discussion of the impact of some legislation that was enacted from the 2022 session. Chapter 509 created 2 new state exemptions for TCA recipients from work eligibility requirements. These state exemptions exempt individuals under the state rules from work requirements. However, they are counted towards the federal work participation rate. The exemptions relate to having the number of having a child under the age of 1. Under the federal rules, there's a 12-month lifetime limit on that, and the legislation prohibited that lifetime limit. And it also created a new exemption for new TCA cases. So the information in the bullets here is on the impact, the number of people who received those exemptions in the first 3 months that those exemptions were available. The number of individuals qualifying for the child under age 1 exemption was relatively small in all 3 months. You exhaust the federal exemption first. The number of new TCA customer exemptions was about 3,500 in November 2022. The number varied a little bit between the months, but in November 2022, it was about 25% of the cases, work eligible cases. And the department notes that this could impact their ability to meet their state work participation rate. The state did fail to meet the work participation rate in federal fiscal 2021. It was unaffected by those new state exemptions because that occurred after the federal fiscal 2021. And the state was assessed a penalty of 10.6 million. This also would impact the maintenance of effort requirement that the state would be required to have, but they are in the process of applying for a good cause waiver to eliminate the penalty. The The reason for the failure to meet it was influenced by suspensions and modifications of the work requirements during much of the period from March 2020 through December 2021. And we've asked the department to comment on the status of its good cause waiver, the factors that impacted the ability to meet the work participation rate, and the likelihood that they'll fail to meet this rate in federal fiscal 2022. Moving ahead to the proposed deficiencies, there were 3 proposed deficiencies impacting FIA in fiscal 20 or for fiscal 2023. They total about $606 million. The largest of these is $595 million for SNAP and PEBT benefits. $371 million of that is for the PEBT benefits, which were not budgeted in, specifically budgeted in fiscal 2023. And that includes funding for benefits that were actually from last school year and the summer due to the timing of the approvals. They were paid during fiscal 2023, as well as anticipated payments for the current school year and the summer benefits for which the department is in the process of applying. The second deficiency appropriation provides $7 million of federal funds from a SNAP administrative grant available through the American Rescue Plan Act, or ARPA. This brings in the remainder of the funds that are available under that grant, which expires in September 2023. And the third is the family investment share of the deficiency you've heard about in other administrations to align the fund split for the Montgomery County block grant with recent experience. So the next thing I'm going to discuss is just kind of the overview of the agency spending, which totals $2.78 billion in fiscal 2024. About 89% of that is in the assistance payments program. The vast majority of that, as you can see in Exhibit 7 on page 18, is for the SNAP benefits, which is about 90% of assistance payment spending and nearly 80% of the budget of family investment overall. Temporary cash assistance benefits are about 7% of the assistance payment spending and about 6% of the budget overall. If you look at the spending in family investment, excluding the assistance payments program, that total is about $314 million, more than half of which is in personnel. Contracts and grants make up, including the Montgomery County block grant, make up about 42% of the budget, and that includes employment and training. And the Maryland Office for Refugees and Asylees, which makes up 9%, which is considerably higher than has occurred in recent years, primarily due to the increase in refugees and asylees and humanitarian immigrants from Ukraine and Afghanistan recently. Exhibit 9 presents information on the changes in the proposed budget compared to the working appropriation, accounting for those deficiency appropriations. I'm not going to go through all the items. I'm just going to highlight a few of the items. On page 20, that first line, you heard about in prior analyses that the department implemented minimum step increases for a number of positions. In November 2022 in family investment, that is for the family investment specialist classifications, and totals about $6 million in fiscal 2024. The next set of changes are in assistance payments, and these are primarily due to benefit levels and anticipated caseloads, and I'll discuss those a little more in a minute. There's increases of about $15 million in total for the Maryland Office for Refugees and Asylees, again, primarily due to the increase in the refugees and asylees. One that I would draw your attention to, though, is $1.3 million in the Refugee Transitional Cash Assistance Program due to a federal request to provide 12 months of benefits rather than the typical 8. Other than that, at the bottom of page 21, the only other change I would note is there's a decrease of $10 million for the food banks. However, this is just a timing issue. These funds were from the dedicated purpose account in fiscal 2023, but have been transferred to the department already. In fiscal 2024, the same funding level is provided. It's just in the dedicated purpose account. So there's actually no decrease in funding for the food banks. Moving ahead to discussion of the assistance payments program. The first thing I'll discuss is related to SNAP. Since April 2020, the state has been able to issue emergency allotments, which has allowed households to receive the maximum allotment for their household size. Those were expected to continue until 1 month after the end of the national public health emergency, but the Consolidated Appropriations Act of 2023 provided a set end date for those allotments in February 2023, and there's no option to continue them beyond that date. The department anticipates average benefits will decrease by approximately $170 per month after the end of the allotments. Despite this change, the fiscal 2024 allowance assumes average benefits will increase from levels that account for both the emergency allotments and PBT benefits, and so that overall SNAP spending increases by $36 million to the total of $2.2 billion that was discussed earlier, despite a caseload decrease. Assuming the same average caseload as assumed in the allowance with a slightly higher average benefit to account for inflation, DLS anticipates that the spending requirements for SNAP would be about $1.26 billion, which is $960 million lower than the allowance. A portion of this could be used to support the pandemic EBT benefits, which, as I mentioned, are not specifically budgeted, but they do intend to submit a plan to provide. And it could also be used to support a new nationwide benefit that I'll discuss in a little bit. Any excess federal funds that are appropriated would just be canceled at the end of the year because they're passed through and they're only received if there are benefits to be issued. However, DLS does recommend it reducing about 100 million of these excess federal funds, but leaving the majority to account for other anticipated potential needs. The fiscal 2023 budget included 35 million in the dedicated purpose account to provide an additional $45 per recipient per month benefit in fiscal 2023 to the TCA and TDAP recipients, which appear in FIA's budget as special funds. The fiscal 2024 allowance continues the additional benefits, but with the regular fund sources, and it's been expressed that it's the intent that this would be a permanent additional benefit. Providing the additional benefit kind of equally provides a disproportionately higher benefit to those who would otherwise qualify for a lower benefit. And we've asked the department to comment on whether a permanent change to the benefit calculation would provide a more equitable impact of higher benefit levels. Moving on to the TDAP caseload and expenditures. The budget in fiscal 2023 assumed a caseload of about 11,282 recipients, which was near the level of the recipients kind of leading up to the budget introduction. However, subsequently, the number of recipients fell quite significantly to some of the lowest levels in program history. They have rebounded to about 8,000 to 9,000, but that's about 29% below the pre-pandemic levels and about 40% lower than the budget was estimated to, was provided to support. And so as a result, as you can see in Exhibit 11, DLS is forecasting a surplus of about $9.4 million in fiscal 2023 due to this lower caseload. DLS generally agrees with the fiscal 2024 estimate, but notes the caseload would still be 17% below the pre-pandemic levels. Moving on to TCA. With the restart of recertifications, the caseload decreased by about 15.5% between January and April. It has increased some since that time, but is still below the level prior to the restart of recertifications. As you can see in this chart, the dashed line representing the level of that the budget could support. During most of fiscal 2023, the number of recipients was higher than that, but it did fall to near that level in December 2022. So if that trend continues, the fiscal 2023 budget would be in line with the spending needs. However, if it does increase from that level, There could be a shortfall, however, there's sufficient funding, as I noted before, with the temporary disability assistance program surplus to cover shortfall. The fiscal 2024 allowance is more than sufficient to meet the estimated anticipated benefits, as DLS currently estimates a lower caseload. However, recognizing there are potential risks to the surplus in this program, as well as some of the other public benefit programs, DLS is not recommending that the general funds surplus be reduced, but is recommending adding language restricting general funds for the assistance payments program to that purpose only, so that any surplus would just revert to the general funds. And this is consistent with other entitlement programs. Page 28 includes information on the personnel. The Family Investment Administration had 294 vacant positions as of the end of the year, a vacancy rate of about 15.3%. This is nearly double the number needed to meet turnover. However, DLS would note that this is lower than the number of vacant positions this time last year. It's about 40 positions lower in terms of vacant positions compared to last year. And the vacant family investment specialists in particular are about 56.5 positions lower. The SNAP administrative grant that I discussed earlier has been up to this point primarily used for contractual full-time equivalents to assist in case processing. And the department indicates that it hired the first of these in September 2021 and anticipates continuing to recruit until March 31st, as the funding is only available till September 30th of 2023. These individuals will have the opportunity to convert to regular positions. And on January 6th of 2023, the department indicated that they had hired 190 unique individuals into these roles, of which 136 remained with the department and 47 had been converted into regular state positions. There's no specific timeline for converting the rest of these, but the department does indicate that those who are interested will have the opportunity. And DLS has recommended committee narrative requesting information on the final number that were converted to regular state positions. Turning to page 33, I'm going to begin the discussion of the first issue in the analysis, which is related to case closures. So as I mentioned earlier, through December 2021, recertification of benefits was extended for all three programs. And so in January 2022, the recertifications restarted. And with that, the number of case closures among all three programs increased. Exhibit 16 on page 34 presents information on the SNAP closures and the reasons for a case closure. It had generally been less than 5,000 for the most of that period in which the recertifications were extended, but increased to 60,000 for the period from March to June 2022. It has fallen since that time, but is still substantially higher than the period in which recertifications were extended. Most of the case closures during this time were due to failure to reapply or recertify. And in most of those months, it was more than 80% of the case closures. As you can see on Exhibit 17 on page 35, case closures of TCA also increased after the restart of recertification. Here, there was a slight difference in the causes of case closure. Failure to reapply was a significant cause of case closure and has been a leading cause, but also case closures related to verification and non-cooperation, so not submitting the required documentation, has also been a significant cause of the increase. And we've asked the department to comment on efforts it has made to improve outreach so that those who remain eligible are able to maintain benefits. We would note that some individuals may choose not to reapply because they believe they're no longer eligible. So this presents information on the reasons for a case closure for TDAP, which has also increased since the restart of recertifications. The reasons for case closure vary more widely because there are more requirements related to the TDAP program in terms of the length of time that individuals can receive benefits, and that for long-term recipients, they have to be applying for supplemental security or disability benefits to receive the benefit. And there have been delays in the SSI and SSDI kind of processing timeliness, which have increased in recent months, making TDAP a more vital benefit for those waiting for a final determination. So in recent months, since the restart of recertification, the no eligible members category of case closures was initially the leading cause. But then in recent months, the SSI requirement compliance has been the leading cause, and more than 50% of case closures were due to that reason. And we've asked the department to comment on the recent closures that are related to difficulties in obtaining medical certification, and also the recent increase in case closures related to failing to meet SSI, SSDI requirements, and whether it's impacted by the difficulties that have been experienced in the federal processing. The second issue is related to supplemental benefits provided for periods when children are not in school. There's a state program that was enacted as a result of Chapter 635 and 636 of 2019, which mandated $200,000 to the program and provides a supplemental benefit of $30 per month in the summer months and then $10 in the month of December. It's only available in jurisdictions that choose to apply, and due to the size of the program, even in the jurisdictions that choose to apply, not all children that are eligible for SNAP necessarily receive the benefit. This program does require a local contribution as well. So in fiscal 2023, the funding for the program was increased to $5 million from that $200,000 mandate. And as you can see in Exhibit 19 on page 39, this substantially increased the number of children that received the benefit to over 100,000 compared to less than 5,000 in each of the two prior years. And the number of jurisdictions choosing to participate increased from 6 in fiscal 2022 to 14 in fiscal 2023. This also is evident in Exhibit 20 on page 40, which shows the participation rate by jurisdiction. So this is the number of eligible children in the jurisdiction that received the benefit. In 4 jurisdictions, Anne Arundel, Baltimore County, Harford, and Queen Anne's County, all children who were eligible received the benefit. Those jurisdictions generally provided more funding more than the required local match to enable that to happen. In other jurisdictions, the participation rate varied. Exhibit 21 on page 41 presents information on the state funds by jurisdiction and the required local match and the local funds that were contributed. Under the statute, the local funds are required to be provided based on the contribution rate in the public school construction program, which does vary among the participating jurisdictions. As you can also see in this exhibit in the column on the second to right, a number of the jurisdictions, 9 of them failed to meet the required local match. This appears to have occurred due to how the required contributions were calculated, so that some of the jurisdictions, for example, provided, if they were given, for example, a 46%, had a 46% match rate and had 372,000 as the state match, they contributed 171,000, which is 46% of what the state provided, rather than providing 46% of the total funds, which is how that it is meant to be calculated. DHS concurs that some of the jurisdictions did not meet the required match, and that they are planning to take steps to ensure that this does not reoccur. The Federal Consolidated Appropriations Act of 2023 authorized a new nationwide permanent summer EBT program beginning in summer 2024. The states will be required to submit a plan to administer the program. In the initial year, the benefit is $40 per month per eligible child, which would be inflated in future years. And there are certain requirements that the state must meet. Generally, enrollment would be based on those who are eligible for free and reduced price meals. The DLS notes that this has an overlap with the Summer SNAP program that I discussed earlier. Some of the key differences are highlighted on page 42. The benefit level of the existing state program total is $100 per year, 90 of that in the summer and $10 in December, while the new program would be $120 in the summer and would be increased annually. But it does not provide a benefit in December, which the current state program does. Another significant difference is in the funding. The current state program is funded with general funds and requires a local match, whereas the new nationwide program will be 100% federally funded for the benefits and only require the state to share in the administrative costs. In addition, the state program is limited based on funding availability and jurisdictions that choose to apply, and the new nationwide program would be available throughout the state. We've asked the department, DLS recommends committee narrative requesting a report on the implementation of the Summer SNAP program in fiscal 2024 and additional information on the new nationwide program, including the overlap with the Summer SNAP program. The third issue in the analysis relates to the EBT card skimming that has been discussed. So in calendar 2021, DHS reports there were only 137 incidents of EBT card fraud, whereas in calendar 2022, the department reports more than 2,300 incidents of EBT card fraud with about 1.68 million of lost benefits, primarily in the SNAP program, but there are also incidents for the cash assistance programs. Prior to the enactment of the Federal Consolidated Appropriations Act, DHS reported that it could not use federal SNAP dollars to replace SNAP benefits that were lost due to skimming. However, the Consolidated Appropriations Act requires benefits to be replaced for skimming that occurred between October 1, 2022 and September 30th, 2024, using federal funds. The department must submit a state plan and receive approval of that state plan before they can begin reimbursing. Those state plans are due on February 27th. We've asked the department to comment on the status of the submission of the state plan and the timing of reimbursing any cash assistance benefits, which cannot be provided through these dollars. But the department did indicate that was an option for using some of the vacancy savings from the higher number of vacant positions than are needed to meet turnover. We've also asked the department to discuss other actions it's taken to improve EBT, the security of EBT cards. The fourth issue is related to the fiscal compliance audit for FAIA that was released in October 2022. It included 10 findings overall, 5 of which were repeated from the prior audit. And DLS is recommending language restricting funds pending the resolution of repeat audit findings, consistent with other places where there are 4 or more repeat findings. We're just going to highlight a couple of these. The full detail is found on Appendix 2, and there's additional information in this. One of the findings was that when the department implemented the emergency allotments, they inadvertently disabled a system control that prevented SNAP benefits from being awarded to those whose income exceeds the federally established thresholds. There are situations in which that is allowable, and OLA was not able to determine how many of the individuals that had income over the limits would have qualified under those exemptions. OLA noted that they did report the issue when it was discovered, but they did not plan to collect any overpayments made in error due to this issue. And they repeated this at the Joint Audit Committee meeting in November 2022. One other item related to the audit that I would like to note is one of the findings was related to contract modification, where the OLA noted that they didn't evaluate whether a new procurement should have been undertaken rather than modifying a current contract. The department disagreed with the finding, and that it did go through a multi-step review process, and they explained that the modification was meant to address issues and delays related to the processing of federal SSI applications and appeals that lengthen the period of time from which the vendor could be paid to like 2 years after the referral, and would make some of the payments potentially unreimbursable because it would occur outside of the contract timeframe. If you turn to page 49, that is the begins the discussion of the recommended actions. Most of these I've discussed already, so I'll just kind of note those and move along to the ones that I have not. The first is related to the contractual FTE conversions, which we discussed earlier. The second is the language to restrict the funds to the purposes for which they were appropriated. The third is to reduce the 100 million from the SNAP. The fourth item is related to the committee narrative requesting information on application processing times, denial rates, and case closures that is used for the analysis that was discussed earlier. The fifth is the report on the summer SNAP program, along with information on how the new nationwide program will be implemented and any overlap. On page 52, item number 6 is asking when the budget is submitted, that the pandemic EBT spending and any new funding for the new nationwide program be identified separately. And the final recommendation is related to the restriction of funds until the repeat findings are resolved. The remainder of the analysis includes updates on the implementation of the pandemic EBT benefits, as well as job placements in TCA and SNAP employment and training cases, as well as a summary of responses to requests in the Joint Chairman's report. And with that, I'll conclude my presentation.
Thank you, Ms. Zimmerman, for such diligence with the agency report. At this time, we'd like to call up the secretary and his team just to give out the agency's response. And Mr. Secretary, we also do have your written response here. Just wanted to acknowledge that. Yes, sir.
Given the time, and I know that all of you are running behind from the floor, I'll amend what we're going to do to make best use and provide you opportunity to ask additional questions. Given that I was going to highlight what was in the written testimony. So first, it's important to introduce at least who's here at the table and here behind me, given the roles. So good afternoon, Chairman McCray, honorable members of the committee. We're grateful for this opportunity to respond to you and to our analyst, and grateful to her for her comprehensive analysis. I'm joined at the table today by Lashira Ayala, to my left, the Executive Director of the Family Investment Administration, also Carnita White, our new Deputy Secretary for the department, and to my right, Safra Chipungu, who is our Chief Finance Officer. Behind me in the crowd is Daniel Waite, Acting Deputy Secretary of Administration, Augustin I knew I was going to do this. Natavagana Yamana, there we go. The Deputy Executive for Programs, Family Investment Administration, Marie McClendon, also Deputy Executive for Operations and Family Investment, Roberta Baldwin, Director of the Worcester County's Department of Social Services, Cora Gishkat, Director of Harvard County's Department of Social Services, Oscar Mensa, Montgomery County's Department of Health and Human Services, he's the Social Service Officer there, Mark Millspaw, Deputy Director of Baltimore County's Department of Social Services, and part of why you are seeing our colleagues here from the jurisdictions is our deep intention to partner with MASTI, the Maryland Association of Social Services Directors. I also want to lift up a couple of things, which is that I can imagine are hot on your minds, which is EBT fraud and our plan there. So I think we're going to spend some time going to a little bit more detail there, just making sure that you have the answers that you need to those, and we have some good news to report there. So I'm going to swiftly go through the recommended actions and issues, our audit findings, and then get to this larger issue. So of the 7 recommendations that have been proposed to the department on actions, we seamlessly concur with all 6. I won't repeat them. Those are easy. We respectfully reject one of them, and we have an idea about why we want to make that argument to you and why it's important, given the fact that there is actually so much going on around benefit frauds happening and our plan to address that. With that said, it was regarding recommended action number 2, which is the one where we respectfully disagree. And essentially the argument is we want to make sure that this new administration has the opportunity and the flexibility to be fiscally responsible and to deal with the issues that ultimately led us there in the first place. We think that reimbursing clients who are the unfortunate victims of benefit fraud requires a new way of thinking and acting. We respectfully recommend your consideration of time for us to demonstrate effectiveness rather than the immediate imposition of restrictions that are likely to have the opposite effect than what we're about to do. And so just in the spirit of being transparent and candid, framed differently, please let me try and do my job as the new acting secretary of the department to proactively engage our team to show you that we can do this differently. And that's really what that's about. I won't go into more detail there. Again, they're in the written testimony. On to, let's turn our attention to the 14 issues. Again, I will not go through all of them in detail. Issue number 1 on page 9, we provided written testimony. For all these, I want to essentially summarize that as we prepared for this budget hearing, as I dove into the audits, as I dove into the material that was provided by the team, there is a common theme, and I want to lift that up and bring that to your attention, which is that over the course of the recommendations, almost all of which we concur, there is room for growth and development in the department. The way in which we track performance, the way in which we engage our team to provide better customer service, the way in which we use data to drive our strategy, to use it to analyze metrics, to ensure that we increase the number of applications that are accepted and reduce those that either fail or are turned down. That's a part of reforming the department, as you will, as one large team effort to behave differently. And the posture that I am trying to encourage all of our team from the first day arriving with the team is that our job should be making life easier for the people we serve, not harder. How might we break down our own bureaucratic obstacles and not just make it easier for the people in whose names we serve, but the staff, who are oftentimes burdened with doing manual operations. So for example, in the written testimony, there was a process with E&E, the enrollment eligibility, which has been the bane of my team's existence. I've talked with many of the staff who expressed that after it was rolled out, technologically, there were a variety of glitches. I'd rather be honest and candid about those. That required our staff then to do manual entry, that delayed timing, that decreased the process time. And how do we respond? We own it, we lift that error, and we say we have a different way of doing business moving forward. So that's sort of the largest summary of all 14 issues. Now I'll turn your attention to the audit findings. For the 5 findings, we concur. And very similar to what I just simply stated to you, we will move forward with a comprehensive corrective action plan. Again, I've shared with the senior leadership team, and I'm hoping they're sharing that with all the staff, many of whom I'm still meeting, that it is my intention in this next fiscal year to ask ourselves the very important question of why do we have repeated findings in our audits? Some of them, as I've noticed, are multiple years long. And if there are systemic issues and they're challenging for our department, rather than simply have them in our audit, raise them up to the legislature, ask for your help, and or propose solutions about what we're going to do next. So with those issues, that concludes the very quick summary of our testimony. And because I know you want to dive into much more specifics. And I will say, let me pause there and ask if you have any questions, then we can go into more detail on these other issues.
I have two quick questions.
Certainly.
Mr. Secretary, two quick questions. One of them is many of the calls that I get is in reference to the siphon benefits. And I just want to say I got a phenomenal director in Baltimore City, so we're able to work through case by case whenever they come to my office, but I'm just not sure if there's a larger scope of the issues. I just want to understand the agency.
Absolutely. Absolutely. There is indeed. And I'm glad that thankful for you providing that opportunity for us to respond. I'm going to do it in two parts. First, I'm going to have Lashera Ayala speak to our operational plan, and then I'm going to dive into some of the additional strategy issues because this is such an enormous issue. And we are prepared to lead both in the state and in the nation around how we're going to do this. And it's going to be a huge lift, but we have faith that we're going to pull it off. So Lashera, why don't you walk through the operational plan, and then I'll comment on the other pieces.
Yes, thank you, Mr. Secretary, and thank you for the opportunity. For the record, my name is Lashera Ayala. I'm the Executive Director for the Family Investment Administration. So for our operational response for the replacement of stolen benefits, we will be simple, seamless, and swift in our response to ensuring that we're making individuals and families whole. And what that in essence means is that the process in which we will ensure we are assisting Marylanders with reporting the stolen benefits is one that is going to have one form, a very simple entry point that will include being able to use one form via their phone, a tablet, calling into a dedicated hotline in which we will have centralized staff that are dedicated for this purpose solely. In completing the one form, it will cover their report for reporting for multiple programs. So if they were unfortunately the subject of having their benefits for their SNAP as well as their cash assistance stolen, they will not have to complete multiple forms. They will have the opportunity to come to any of our 23 counties as well as Baltimore City offices, and they will have direct assistance with the completion of the forms. And our team, as I mentioned, it being a dedicated team, will be swift in replacing the benefits for those individuals and families.
Thank you, Lashera. I wanted to add a couple of important components to what our analyst lifted up so that we're clear for the record. So as soon as the bill was signed by President Biden in December, we waited for instructions from the federal government about how we can apply to make sure that we're leading in at least our state efforts. We submitted on behalf of the state of Maryland on February 10th our response to what we're going to do around our three-point plan. We intend to lead both the state and the nation, and we just learned as of 11:29 this morning that our plan was accepted by the federal government. So not only were we the first in the nation to respond to the federal government's guidelines, we are also the first in the nation to receive approval from the federal government. Now we will transition to a deep operational state around trying to figure out how to bring this plan to life. I was just sharing with Lashera literally minutes ago that one of the things DHS is going to have to do differently is how we partner with our community-based organizations, our advocacy partners, the legislature, to use every one of their relationships and networks to have a whole of government, whole of Maryland response to make this happen. Similarly, as I've been bringing to various hearings, this particular card is the one we use, right, for all of our people use to get the help they need. And it is not as secure as it needs to be. So we are working extra hard to figure out how we can better partner with our provider conduit, who is our EBT provider. And in fact, I've reached out to the CEO, Cliff Skelton, and we'll have a conversation with him tomorrow morning so that I can make clear on behalf of the people of Maryland our path moving forward and our expectations for partnership, our expectations for the way in which we work with our vendors, and our expectations for helping make families whole in the state of Maryland.
Well, thank you. My next question and last question, quickly, when I read through the advocate's testimony, there was one portion in there where they praised the $45 benefit for TCA TDAP, but they also talked about it being a base benefit versus the discretionary add-on. I just wanted to make sure that you got the opportunity to comment.
Sure. And I think it's a two-parter. One of them is, one, we're thrilled, obviously, the governor supported this in terms of this budget season. So we are deeply appreciative, and that's helpful to helping make families hold more consistently. The commitment I can make right now to not ever get ahead of the governor or the legislature is that we intend to do a more thoughtful analysis of all the benefits so that this next budget cycle, we propose a variety of options so that we can continue in that path forward. But that's what we intend to do moving forward.
Seeing no further questions, Mr. Secretary, every time I hear you, I'm energized and ready to get to work. So I'm pretty sure
There's plenty to do, brother, let me tell you.
Feels the same. So just thank you all for your leadership from that standpoint. And Ms. Zimmerman, it's always a pleasure to be able to hear you report out on your work, your commitment to our great state of Maryland. Thank you. At this time, we're going to call up some of our public testimony. Okay. And Mr. Hocker, you would be first, and we're allowing 2 minutes of public testimony. And I'm asking for Mr. Hocker for movable feast. And Seacott for movable feast.
Mr. Hocker's not with movable feast. I think there was a mistake with my account online. I apologize for that.
No problem at all.
I'm so sorry. He's with a totally different organization. I apologize for that. I'm Ann Seacott with representing Movable Feast today. Thank you, Mr. Chair and members of the committee. Movable Feast mission is to improve the health of Marylanders experiencing food insecurity and chronic illness by preparing and delivering medically tailored meals and providing nutrition education, thereby achieving racial, social, and health equity. Movable Feast helps to maintain quality of life for thousands of individuals throughout Maryland. For everybody that they serve, food is medicine. That's a theme you're going to hear a lot of this term. I'm here today with a thank you to the department. We are grateful for their support in the grants that they provide to help us get this work done and serve thousands of people who need special diets to address their clinical conditions. We want to thank Ms. Ayala and her staff for coming out for a site visit at our home base in District 45. We're appreciative for really, especially some of the emergency support that they've been given to Movable Feast as well as its sister organization that serves the other part of the state during the pandemic. So we're just looking forward to continuing a strong partnership with the department.
Thank you, Ms. Seacott. I say it all the time, but it's never can hear too much, but thank you for your leadership.
Thank you.
At this time, I'd like to bring up Ms. Lisa Klingenmeyer from Welfare Advocates.
Thank you, Mr. Chair and members of the committee. My name is Lisa Klingenmeyer. I'm the Assistant Director of Advocacy at Catholic Charities of Baltimore, and I chair Welfare Advocates, which works for a strong safety net and for programs that build economic security for low-income Marylanders. We're also here today in strong support of the department. After reading the Secretary's remarks online, a lot of what I wanted to say is thank you, and we look forward to the partnership that we're going to be able to create in the state. We do know that there's been long-standing issues with low-income Marylanders being able to access programs, maintain their benefits, and then build the financial security to move off of benefits. And the data bears that out. Maryland is one of the highest rates of deep poverty in the country. And so we really are looking for ways that we can enhance our safety net programs. So thank you, Mr. Chair, for pointing out the $45. We are excited about that and excited about conversations we can have with the department on looking at our safety nets as a whole and how can we start moving families into a position to be able to afford housing and some of the other necessities that are just impossible on the benefits that we have now. Just 2 more points. We also agree with page 27, the extra money in TANF. We would like to see that stay in the TANF program in addition to being able to backfill TANF funds that have been stolen off cards. There's also some really good ideas we have on how we can enhance the program. Currently, the department takes away $60 from families if they happen to also get housing assistance while they're on temporary cash assistance. We don't think families should be penalized for accessing 2 programs. So we would like to see that be removed. Most states don't penalize families that way. So if we were to remove that $60 deduction, we could potentially use those extra funds to do that. And then lastly, our TANF block grant is the majority of it's not spent on cash benefits in Maryland. As a state, we spend it in a lot of other locations. Same thing with our TANF surplus. So we would really look forward to conversations about, as we look at this TANF block grant and the money we have, how can we be investing that in low-income families? But our main message is thank you. We look forward to continuing to work with this body and all of the great advocacy that you all do and the secretary and his team.
And thank you, Ms. Klingenmeyer. I appreciate you're always a partner in progress.
Thank you.
Seeing no questions, colleagues, this ends our hearings today for Health and Human Services, and look forward to seeing everybody bright and early Monday.